Hi, I'm Dr. Buzz Korth, and I want to talk to you a little bit today about Push Patch. What is Push Patch? Well, Push Patch is a company that we developed that uses iontophoresis to deliver molecules that are very beneficial to the body. So, what is iontophoresis? Well, here's an iontophoresis patch. Unlike iontophoresis patches of the past, that the first ones I ever used in my practice were like a TENS unit with wires going to it. These units here have their own microprocessor. So all you do is you simply apply it to the area and pull this out, which activates the battery. And then what happens is it uses electrical energy to push the molecules directly into the bloodstream. So think of it as an IV without a needle. Now, obviously, you can't iontophoresis everything, and we really don't want to. What we focused on with Push Patch are molecules that have a small enough size to be able to be pushed with iontophoresis, and also molecules that aren't really available, bioavailable orally. So if you can take something orally, or if it has a long half life, then injections are fine. But the molecules we're dealing with are NAD plus, glutathione, and BPC 157. Why we choose those molecules? Well, number one, those are molecules that can benefit a large percentage of your populations for different type of conditions. And number two, they have very short half-lives. NAD half-life is about an hour. BPC 157 half-life is only 30 minutes. And glutathione, depending on what research you read, is between 10 and 90 minutes. So what's a half-life? Well, half-life is if you take a medication, for example, we'll take BPC 157, and a standard injectable dose of that is 300 micrograms. Well, the half-life is about 30 minutes. So when you do a BPC 157 injection and you do 300 micrograms, 30 minutes later, you're only getting the dose effect of 150 milligrams. And then 30 minutes after that, you're getting the dose effect of 75 milligrams. And you go down and there's typically 5 half-lives and you don't get a dose effect. So you can see if you're using BPC 157, we'll say for inflammation or pain in a joint, really to get the time under dose, you'd have to inject that joint 4 times during the day, which is inconvenient. And BPC at 157 also, although it is orally bioavailable, you lose about half the strength. So, and you also lose some of the benefit. There is research that shows that, the closer you can put the BPC 157 to the site of injury, the better it's going to help to heal. So although there is a systemic effect, you also do want to put it as close to the site of injury as possible. And obviously with the patch, if you have elbow pain, neck pain, wherever, you can put the medication exactly where you want it to be. And the time under dose will be greater because these patches are 12 or 14-hour patches. We have both. You're getting dosed for the full 12 or 14 hours instead of, that short 30-minute half-life. So that's why these patches are so great. The same thing with NAD and glutathione. That as we had mentioned, the short half-life of those. So typically what people are doing, NAD is not orally bioavailable, and people can take. There's a medication or a molecule, I should say, called NMN, which increases intracellular NAD, but it doesn't increase extracellular NAD, which is very important. So really, the only way to increase that extracellular NAD, which a lot of the benefit comes from, is either you have to either take an IV, but it has such a strong effect on the mitochondria that the IV of NAD is typically a 3 to 4 hour IV. And who has time to sit on an IV for 3 or 4 hours? And if you try to go faster, you don't feel good. But with the patch, you simply put the patch on, go throughout your day, and you're getting dosed NAD for 12 to 14 hours through the day. So you just can't beat the method of delivery. It's very easy, very safe. And the same thing with glutathione, that short half-life, 10 to 90 minutes. Everyone needs glutathione, so why not wear the patch? You're getting dosed all day long. So that's what Push Patch is all about. We're really excited about it. The results have simply been incredible. Definitely check us out. So why would you use Push Patch to get doses of NAD, glutathione, and BPC as compared to traditional injections or IV infusions? Well, number one, because it's just easy, right? So I know a lot of people, when they think iontophoresis, they don't know what it is, or they're thinking of the old-fashioned iontophoresis where you have to wear like a belt clip and wires hanging around, which obviously no one wants to do that. With the new technology we have, here's your iontophoresis patch, very easy to use. It has its own microprocessor, so very simply, we basically ship the NAD, glutathione, or BPC, whatever you want. We do ship it in powder form, which is very important. What you have to remember with all of these molecules is once you add water to these, or saline, they break down really quickly, and the shelf life is much less than even 30 days. So you want them to be as fresh as possible. So that's why we deliver it in powder form. The patient has this. They simply add 1.5 mLs of water to this, go back and forth a few times, and then you're going to take the molecule, put it on the patch, spin it around. It'll be on here, and you apply it. So very easy to do. The other huge advantage of this is obviously, you can put it, with BPC 157, we'll talk about, obviously if you're injecting BPC 157 due to the short half-life, 30 minutes, you're going to have to inject it, 4 times a day to get a good dose effect. Who wants to inject themselves 4 times a day? When you use the patch, you simply take the patch, put the medication on it or the molecule on it. And, if it's lateral epicondylitis, you put it there. If it's neck pain, you put it there. And you're getting dosed for 12 to 14 hours. It simply can't, much better than injection. And orally, BPC 157 is orally available, but the problem is you lose about half the strength. So, if you want to get a 300 microgram dose, you're going to have to take 600 micrograms. And remember that short half-life, you're going to have to take that 600 micrograms multiple times every day, which gets very expensive. So iontophoresis for BPC 157 makes a lot of sense. It's much less expensive and much more effective. The same thing with NAD and glutathione. NAD, glutathione, those IVs, although effective, it's a 3 to 4 hour IV. And who has time to sit around and do a 3 to 4 hour IV? And the other thing is the very short half-life. So even if you get your 3 or 4 hour IV, remember the half-life of NAD is an hour to 2 hours. You kind of lose the effect of it after you come off the IV within an hour or two. So you just don't get a big dose effect. But the patch, the reason I love these things and our patients love them is, if you have a really big day and you want to be on your A game, because anyone who's done NAD knows that when you have NAD and your levels are up, you're mentally sharp, you have more energy, and your cardiovascular probably improves 20%. It's crazy. You put the patch on in the morning and you go rock your day out. And you feel amazing all day. There's no side effects. And at the end of the day, or when the 12 or 14 hours up, you pull the patch off. It's that easy. So that's why the iontophoresis delivery method for NAD, glutathione, and BPC makes a lot of sense. Why use BPC 157? How can I use it with my patients? And why is it best to use with iontophoresis patch? Well, number one, BPC 157 is kind of known as the Wolverine peptide. It's a naturally occurring peptide. We have it in our bodies already. But what they found with research is BPC 157, when you either inject it or apply it with iontophoresis to an area of injury, it helps the area heal in about half the time, which is crazy. And it's not an anti-inflammatory, so it's not like you're putting a pain medication on and you're masking something. You're literally helping your body and your own stem cells heal much quicker, which is amazing. And that's why it kind of fits in that regenerative medicine area. Now, as I had mentioned, BPC 157, we know it's very effective. There's, just Google BPC 157 and healing. It helps ligaments heal, bones heal, muscle tears, post-surgery, anything you want to heal quicker. BPC 157 can cut that time almost in half. So it's just this amazing thing. Then you have to decide, well, how am I going to get it? Well, it is available via injection, but due to the short half-life, BPC 157's half-life is about 30 minutes. So what that would basically mean is a typical injection of BPC 157 dosage would be 300 micrograms. That means if you inject yourself, we'll say you have back pain in your back, but 300 micrograms, within 30 minutes, you only get the dose effect of 150 micrograms. And then after another 30 minutes, you're getting the dose effect of 75 micrograms. As you can see, every 30 minutes, you lose that dose effect. So that's why if you're injecting it, you really should be injecting 4 times a day, at least, to get a good benefit. With the patch, it works much differently. With the patch, you're going to get, the patches come with 1,000 micrograms, which is a larger dose, but it's spread out over 12 to 14 hours. That's how long the patches last. So instead of sticking yourself with a needle, 4 or 5 times a day, you simply take the patch, you put the molecule on there, apply it to the area, and just wear it. You don't feel it. It's comfortable. It's pretty much self-contained. So a much more effective way to treat an area. And I had also mentioned before, you can take and buy BPC 157 orally, but the problem with that is twofold. Number one, you lose about half the strength going through the GI tract, so you'd have to double the dose. So now you're talking about you need at least 600 micrograms, and remember the half-life is that short 30-minute window. So, really you're going to have to take 600 micrograms 4 or 5 times a day to get the same dose effect, which gets very pricey. So by using the push patch for BPC 157 to heal any type of injury, it's going to be much more convenient, and it's going to save you a bunch of money. Why use NAD plus and glutathione? Well, if you're into any type of biohacking, you watch any podcasts from Huberman, Joe Rogan, they talk about NAD plus and glutathione quite a bit. And it's because these things really are the cornerstones of anti-aging technology at this point. So what does NAD plus do? Well, I'm going to try to keep this really simple, but basically you have this thing called the Krebs cycle, and that's how your body takes fats, carbohydrates, and proteins and produces them and gets them turned into energy. But the coenzyme that makes that whole process work is NAD plus. And the problem is, as we age, every 5 years, our own NAD plus levels decrease 20%. So by the time we're age 40, our NAD plus levels are half of what they were when we were younger. So as you can see, and that's why as we age, our metabolism slows down, our ability to heal slows down, because we're not able to process fats, carbohydrates, and proteins into things we need to do to produce energy and heal ourselves. So we need it at the end of the day if you're in anti-aging. Now, the problem is you can't take it orally. It won't survive the gut tract. So really the only ways you can get it is with an IV, and IV does work. But NAD is such a powerful coenzyme that when you do this IV, it's a 3 to 4 hour IV. You have to do it very slowly to get a decent dosage, okay? And we're talking about, at least 500 milligrams. With the patches, we have 1,000 milligram dosage, but you need at least 500 milligrams to make a difference. Anything less than that, you're not going to have a real good effect. And then the half-life of NAD is only between an hour and 2 hours, depending on what research you read. So think about it. You're going to sit on an IV for 3 to 4 hours. And then literally when you get off that IV, the dose effect, remember with half-life, so if you did 500 milligrams of NAD on an IV and the half-life is an hour, so 1 hour after you have the IV, you're only getting the dose effect of 250 milligrams. And 1 hour after that, you're getting the dose effect of 125 milligrams. So you can see it wanes off really fast, which is what you don't want. Ideally, you want the cells exposed to NAD plus for a long period of time. Well, with the push patch, basically you're using iontophoresis, so think of an IV without a needle, because it uses electrical energy to push that molecule right through the skin directly into the bloodstream. And these patches are 12 to 14 hours. So you simply put the molecule on here, apply the patch, and then you're rocking all day long, getting dosed NAD plus all day long. What are some of the benefits of NAD plus? Well, definitely increase energy, definitely increase mental acuity. You get rid of the fog. You feel very sharp. Lots of other things. We've seen patients, it improves kidney function, it improves pulse ox, your oxygen levels in your blood. I hate to sound cliche, but NAD is what helps your cells work. That's what makes your cells produce energy. So NAD plus, when you restore those levels, kind of helps everything because it decreases, it makes your cells work better. So if your cells work better, everything works better. That's the benefit you get with NAD plus, and it's a very convenient way to do it. So if you haven't tried it, you have to try it. I mean, I've never had one patient take these things that didn't notice a significant difference. I mean, a lot of people take vitamins and, like I take vitamin C, but I don't feel when I take vitamin C. When you do NAD plus with the Ionto patch, you're going to have mental clarity, better sleep patterns, and definitely more energy. So what do you have to lose? So as a physician, why would I want to incorporate push patch into my practice? Okay. Well, what is push patch? Well, push patch is using iontophoresis technology to deliver different small molecules like NAD plus, glutathione, and BPC 157. And our patients, these are all things our patients want. Patients are becoming more and more educated with the internet. They know what BPC 157 is and how it can help with the healing process. That they know NAD plus and glutathione. Everyone kind of needs them. That's kind of like the new anti-aging thing. But like with BPC 157, some of the challenges you're going to run into as a physician is, number one, in its injectable form, the FDA has really cracked down on it. Compounders aren't making it. So if you want your patients to get the benefit of this amazing molecule, you're really, the only way you're going to be able to get it, it's orally bioavailable, but very weak. So it's going to be expensive for your patients, and the short half-life of it would basically mean, so number one, you have to double dose it. Orally, you lose 50% of it. So if you want to do a 300 microgram dose, you're going to have to dose 600 micrograms to get that you were doing with injection, double the dose, 600 orally. And the short half-life of BPC, which is about 30 minutes, means they're going to have to take 600 micrograms 4 times a day, which gets cost prohibitive for your patients. With the patch, the beauty is they're going to get 1,000 micrograms dose over 12 to 14 hours, so it's much more effective. The other beauty is these are by prescription only, so your patients aren't going to be able to go on Amazon and buy them cheaper. You have to prescribe them, although once you prescribe them, you can show them how to use it and they can put it on themselves at their house. So that's another huge benefit. And the same thing with the NAD plus and glutathione. NAD plus and glutathione is very popular to be done at these IV drip bars. But the problem, if you've done them in your office, is an NAD drip IV is 3 to 4 hours. So that means the patient's sitting in a chair in your office, getting the IV to 3-4 hours, and you can't, to get a good dose, which is at least 500 milligrams. Anything less than that's really not effective. So using the Ionto patch, instead of them sitting in your office for 3 or 4 hours, you can get them a patch. Number one, it's going to save you money because this is less expensive than doing IV, and more effective because, once again, you're getting a higher dose than you get with IV, but you're also getting around that short half-life of NAD. NAD half-life is, about an hour to 2 hours. Glutathione is 10 to 90 minutes. So that short half-life means even the IV is not as effective using the Ionto patch, which is a 12 to 14-hour dosing. And each patch, you're going to get a dose of 1,000 milligrams of NAD plus with 300 milligrams of glutathione. So a very high dose over a long period of time. So much more affordable for your patients. It doesn't occupy space in your office, and very effective. And who would be good patients that would qualify? Well, anyone who's trying to heal post-surgery, PRP, A2M, allograft procedure. If you want things to work better or people to heal better, even decompression patients, if you want your patients to heal better, use BPC 157. It's a cheat code. They're going to heal better. Anyone has any type of gut issues, colitis, Crohn's disease, BPC. I mean, if you use it in your practice, it's like a cheat code for gut issues. It just fixes them. It helps you get all the inflammation out of the gut. And with NAD plus and glutathione, any of your patients that have had, concussions, traumatic brain injuries, very important, any neurodegenerative conditions, we've literally used on patients that with Parkinson's that had noticeable shakes. The shakes go away. Very effective, and tons of good research to back this up. And basically, and as an anti-aging molecule, it's also very powerful. So it gives you competitive advantage over your competition. You're going to be able to offer very high quality molecules that your patients want, and it's also very easy to do. It's simple. You put it on the first time in the office, and then show the patient how to do it at home, and it's recurring income. In our office, we have patients that basically they're on auto debit. They come in, and we're shipping these patches to them on a monthly basis, and they love them. So it makes a lot of clinical sense. So if you want to help your patients out, get on the push patch.